Good morning, everyone. Elections Canada knows there's a problem with Dominion voting systems, knows that it's much better to have paper ballots counted by hand in front of scrutineers. And so with all of this craziness around Joe Biden's obvious election to president, they tweeted this out. Elections Canada does not use Dominion voting systems. We use paper ballots counted by hand in front of scrutineers and have never used voting machines or electronic tabulators to count votes in our 100-year history. Now, I think that it's very interesting because there are pieces of our election system that use the Dominion software, specifically the leadership races in the LPC, the Liberal Party of Canada, and the CPC, the Conservative Party of Canada. So they use Dominion voting. So this is a Wayback Machine from 2014. And, you know, what did Dominion give us? Justin Trudeau to vote for in the general election. You know, with your hand-counted, scrutineered stuff, right? But all we got were Dominion-selected candidates, right? There was a whole bunch of very, very interesting stuff happening with the leadership race in the Conservative Party, and took Andrew Scheer 12 rounds to win in a razor's edge win, and then they destroyed all the ballots. Isn't that inconvenient? Gosh darn it, eh? But, you know, Dominion's used. It's not like it's not used in Canada, but apparently not for the federal election. But it is used for the provincial elections in New Brunswick and in Ontario. So that's very interesting. I had this all queued up, and so I'll queue it up again. Hold on a second. This is President Trump's legal team, one of his legal team, Sidney Powell, and she is talking with an interviewer, and he says, well, they're talking about the Dominion voting machines and their capabilities, and I'll just let them do it. I'm sorry if the volume's not correct, but here we go.
And I just really want to be very, very careful here and be very meticulous about this. It's one thing to be able to watch it and decide how much more input you need to change the number, but now you're saying there's an actual way to change the total, the vote tallies within the system?
That's exactly right.
That's a very, very big claim there. I mean, that would be voter fraud defined right there. What's the next step?
It's massive criminal voter fraud writ large across at least 29 states. It could have been happening. Anytime a voting machine was connected to the internet, and we have evidence that many were, it was obviously happening. It's obvious from the algorithm and the statistics that our experts are tracking out for batches of votes and when the curves changed.
So I wanted you to hear that. So this is massive and criminal, and the evidence is actually in the votes. The evidence is actually in what they used to win, right? Like, oh, here's the scatter plot of the votes and how they came in and when they came in and when things started to change. He says, I can show you. She's going to prove it using the evidence of the votes that they are using to claim victory. Very interesting situation, very interesting stuff. And, you know, but I think that it's so super interesting. Elections Canada doesn't use Dominion. Why not Elections Canada? And why is it okay for our leadership, for political leadership teams to be selected using Dominion, right? Are they connected to the internet at all? Why did they destroy all the CPC ballots? Now, Justin Trudeau was very, very popular. Do I think that he needed Dominion to help him win? Probably not. Not the first time, anyway. Not the leadership of the Liberal Party of Canada. So here's Donald Trump using that as evidence. He says, this says it all. And he's referring to the tweet that we were just going through. I don't know. It doesn't quite say it all, Mr. Trump. It says just a part of our story, not to mention all the rampant rules applied differently. Faith Goldie wasn't allowed to buy advertisements when her competitors were. And then although that's held true across, there were places during the federal campaign where people were saying that places wouldn't rent to them or whatever because of the party that they were representing. So that's not quite the whole story. But Dominion selects the people we get to select in the general election. Is that okay with you? All right, we're going to get into COVID now. And it's interesting because there's some pushback in the news. It's like there's some people writing about how, okay, enough's enough. We're done with these lockdowns now. Anthony Furey saying this obsessive reporting with COVID numbers is bizarre, says Dr. Martha Fulford, a professor at McMaster and infectious disease physician at Hamilton Health Sciences. Nobody should be giving COVID numbers without also giving economic numbers on and suicide numbers. This is about that. Time for a more balanced approach, says Ontario's doctors concerned with restrictions. So there's this side of things, and then I'll show you the other side of things in a minute with a couple more stories. But here we go. Several Ontario doctors are speaking out to call for a more balanced approach for maintaining the pandemic now that more potentially harmful restrictions are being introduced during a second wave of COVID-19. We've already seen the impact of lockdowns on people's lives, says Dr. Neil Rao. Everybody came to an agreement that we would seek a balanced approach, but now we're falling back. Balanced approach. There are people being arrested these days for coming to Costco without a mask on and then refusing to leave because they have an exemption under the law, and then the police show up and are aggressive with them. I have the link, but I didn't put it in today's show, but I'm mentioning it because it's important. I'll tweet it out. Rao, an infectious disease expert, a specialist and assistant professor at the University of Toronto, also laments that some doctors and public health officials are now advocating for an approach known as COVID zero, where more aggressive measures are introduced to entirely eliminate the virus. I mean, Coke Zero is awful as well, right? But this COVID zero is an even worse idea. The impact on children is of particular concern for Fullard, I scroll down, who also focuses on pediatrics. It's easy to look at COVID numbers. It's not so easy to look at the impact on children, says Fullard, referring to the closing of schools. We know that when it comes to the loss of education, you have a dramatic increase in not graduating from high school or succeeding in life, a shortened life expectancy. Sargent agrees. Let's try, at the very least, with our kids to give them some semblance of normalcy. I think that it's interesting, like very, very catastrophic language here. Like if you don't graduate from high school, you're not going to succeed in life and you have a shortened life expectancy. That may all be true. I mean, like, yeah, having not graduating high school results in having to do labor or menial jobs for a long time. That's harder on the body and you may die sooner. And it also probably correlates with more drug use, more alcohol intake, more smoking, blah, 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 all that stuff, right? Like, I mean, that's probably all kind of data backed and stuff. And it's so data backed that them kind of checking it in this article here is kind of like, oh yeah, okay, we all kind of understand that. If all of us can't articulate that. But I think that that's really crazy to sentence an entire generation of people, even just the kids in like grade 11, 12, even grade 10 at this point in time. Like you need marks to get into university, even the university kids, right? Like they're all being robbed of some very important development time. They need to be on their own and trying things out. And I mean, yesterday I was talking with Greg and speaking moistly. Or was I doing the show? Anyway, it doesn't matter. During the show, I think maybe I was doing the show. How do you navigate like kissing somebody for the first time? And I was like, oh, like you used to just stretch and put your arm over somebody's shoulder. And now you have to like take off your mask and like hope that their mask is off too. It's a whole thing, right? Like easier to swipe right, but it's dehumanizing. It's dehumanizing, right? And dehumanizing people, teachers to kids, having masks on kids, even if the kids aren't masks, having masks on teachers is difficult because like there's so much nonverbal. There's so much that's transmitted through how you hold your mouth and how you hold your eyes and the tilt of your head. Everything is very, very, there's so much nonverbal communication. It's an unbelievable travesty to steal that from people. And not to mention the time that the time that's been stolen and the rights that have been stolen from us. The time for people who are at the end of their life, the people who have passed away in the last few months who haven't been able to see their family, right? Like how awful. What these people have stolen from us is absolutely abhorrent. Absolutely abhorrent. It's terrible. Here's the CP24 reporting. Canada says, I scooped them by like a week. Canada says influenza cases down almost 98% so far this season. It's not just, I was talking about Alberta when I talked about this, but they're saying all of Canada. Where did the flu go? And you know what? You stay in your house and stay afraid. It's not the flu that's going to get you. It's going to be COVID-19. Watch Togo. Okay? Go watch Togo. The beginning of Togo, spoiler alert, there's I think it's flu, but it's something else maybe. There's an infectious disease and it's got all the kids. All the kids are sick. And this one guy and the dog have to go and get the medicine to cure the kids, right? So he goes and gets the medicine and it's a happy Disney story, so, success. But everybody knew that there was an emergency then. You didn't need fines. You didn't have to tell people don't have birthday parties. You didn't have to tell people anything. People knew the stakes. People understood. And now we're in a situation where the flu is eradicated. The flu is eradicated. And that's not headline news everywhere. Celebrate. Let's have a party, everybody. Right? Like, no. Stay in your house and stay afraid. The flu's eradicated, but COVID-19 is going to get you. And here's where we start to go on the other side of things. Oh, no. This is Dr. Albert, this is Senior Doc says Alberta politicians playing medicine, media driving hysteria, okay? And his name is Dr. Roger Hodkinson. Sorry if I've got that wrong. And here's a couple of Twitter posts, but I'm not going to use Twitter because the sound is sometimes terrible. So here is a YouTube post. The whole 5 minutes is worthwhile. He is angry, and rightfully angry, rightfully so. Here we go.
Masks are utterly useless. There is no evidence base for their effectiveness whatsoever. Paper masks and fabric masks are simply virtue signaling. They're not even worn effectively most of the time. It's utterly ridiculous seeing these unfortunate, uneducated people, I'm not saying that in a pejorative sense, seeing these people walking around like lemmings, obeying without any knowledge base to put the mask on their face. Social distancing is also useless because COVID is spread by aerosols, which travel 30 meters or so before landing. And closures have had such terrible unintended consequences. Everywhere should be open tomorrow, as was stated in the Great Barrington Declaration that I circulated prior to this meeting.
The Great Barrington Declaration, of course, has been removed from Twitter. When I used this yesterday to argue with a crazy lefty, he told me, "You found one doctor to agree with you." And I said, no, all the doctors who agree with me have been silenced off of all social media and their videos removed. Here's the Dr. Williams. He's the medical officer of health for Ontario. And here he is saying masks don't work and shouldn't be worn. It's so sad to me how quickly our freedom and our country has given itself up. It is gone. It is gone. And there is no politician who is working to restore normalcy. Not one. Not one. Not in an honest way. Not from municipal, not all the way up to federal. Nobody is looking to get back to normal. Not one. And yet, here's the medical officer of Ontario back in the spring of 2020 of this year saying masks don't work for the general public. Here we go.
We've never recommended the wearing of masks in public. Nevertheless, I'm aware that certain other cultures in society like to do so. And one of the problems with wearing the mask is, as both Dr. DeVille and Dr. Yaffe alluded to, is I see people wearing the mask and then they're handling stuff and they put their hand in the mask and touch their mouth and they do different things like that. The mask may not be cleaned on a regular basis, so you actually may be recirculating stuff. So there's a lot of things about the handling that. The same as you do in the hospital, you're very strict about how people wear them and change them and handle them, how they put them on and take them off. So it's not just not just a clothing thing to do, because it's supposed to be used for very specific purposes.
Very specific purposes. We shouldn't be using them for healthy people. We should be using them for sick people and people in hospital who know how to wear them. So why is it being taken as absolute, the best science now that masks work? Because the cases are down, but they're not down. Not at all. Here's something that I thought was funny. Don't have any kind of hope. Dr. Williams the other day said, "Oh yeah, we'll be green by Christmas. Have a little bit of hope, people. We'll be green by Christmas, no problem." And Christine Elliott says, no way. No, she's not a doctor, by the way. As far as I know, I don't believe she's Dr. Elliott. But she saes, the green zone for Ontario by December. And one day after Dr. David Williams suggests it could happen, Ontario's health minister, Christine Elliott, says, not so fast. Don't have help. Don't have hope. Don't have hope. You stay locked in your house. How often do prisoners get locked into a cell with some people and they don't have any kind of rights to appeal that process? Do they get lawyers? Do they get to have their rights and their all of that stuff read to them? Do they get an appeal? Do they get to be listened to by a judge? I feel like these lockdowns are unconstitutional, fly in the face of our basic charter rights. I feel like they can't just unilaterally lock us down because they feel like it. And yet here we are. And so this is now we're getting into the welcome to the worst timeline part of the show. This is Brian Pallister. He's the Premier of Manitoba. Okay, and we're all part of Team Manitoba. If you see something, say something. Voice your concerns and share information by calling our COVID-19 tip line and pressing option 3. And there's a lot of people saying, where do we report a premier who's showing communist tendencies? Sorry, I can't find it now. It was the first comment when I was looking this morning, but I think I was looking very early. So anyway, I thought that was funny, but this isn't a joke. Like, this is dead serious. This is deadly serious, right? Like, they aren't kidding. They're not going back to normal. They're not interested in going back to normal. In fact, they're going to double down. None of it is going to a 2-week lockdown. Hey, none of it. Spoiler alert, it's not a 2-week lockdown. Don't let them do this, because if you go, you never come back. You never, ever come back from the lockdown. Never. Here's Belinda Carriolis, and she's talking about, do you guys think this is an opportunity for a reset, or can we get back to normal? Where are the politicians who are going back to normal? Maybe we should just start the back to normal party, and that'll be it. Back to normal. Back to normal with the policies at Queen's Park. Back to normal with the rule of law in Ontario. Your skin color doesn't determine exactly what the law should be. It's unbelievable these days. It's unbelievable what's going on in our court systems and in everything. But anyway, here's Miss Carriolis. Do you guys think this is an opportunity, or do you think this is something that we should go back to normal? They don't answer no. They don't answer no.
Tragedy, and the Premier's measures and response are a travesty, but not everyone sees it that way. On September 29th, the Premier's good friend, Prime Minister Justin Trudeau, appeared on a United Nations video conference to state that he saw COVID as an opportunity. I couldn't believe it. Prime Minister Trudeau said COVID was an opportunity for a reset, to reimagine our economic system and to meet the UN's 2030 agenda goals. Since the Premier is following the Prime Minister in all policy areas, I'd like to know, does the Premier agree with Prime Minister Trudeau and view COVID as an opportunity for government to reset our economy? Yes or no?
Minister of Finance.
So, Mr. Speaker, COVID is clearly the challenge.
So the Liberals, and everybody does this, and the Conservatives in Ontario, take a question and then pivot to the relevant talking point, right? So she asked about COVID. Do you see it as a positive, or do you see it as an opportunity for a great reset? And they pivot to, we're going to do everything we can to help people. So they don't say no. No, we don't see it as an opportunity. We want to keep things normal. Their pivot is, we're going to help people, right? None of it. Lockdown, don't do it. Here's Anthony Fury. He says, this is heartbreaking. The first wave lockdown restrictions meant that many children with scoliosis, cleft palate, hip dysplasia, and limb deficiencies, I think that's what it says, limb deficiencies, yeah, missed the window for their life-altering surgeries. We did this, and we're going to pay the price for this. We are paying the price for this. New Brunswick Public Health reports adverse events following 3 flu shots. This is November 16th, 2020. The flu shot has been around. The flu vaccine has been around since for 40 years, I believe, since at least 1980. And it's still having adverse events. And they want us to take en masse a COVID vaccine on their say-so? Yikes. I don't think so. Here's Guelph's Public Health. Yeah. I was like, anger, right? Because they're lying. Guelph's Public Health Unit says people visiting homes of friends and family has become the #1 cause of spreading COVID-19. Here it is. Here's the article, or there's a little conversation and global news. Guelph's Public Health Unit says people visiting homes of friends and family has become the #1 cause of spreading COVID-19. As a result, Wellington Public Health's medical officer of health is urging residents not to visit homes or allow visitors to their homes. What spread? This is in Guelph. 119 active cases. Guelph's a city of more than 100,000. We have 1 person in hospital, 11 fatal cases, and that hasn't changed in months. We haven't had a death. Months. So 119 people in active cases. 119 active cases aren't even that many in hospital, because one's in hospital. How can we be at the top of our capacity with 1 in hospital? What does that say about our medical unit? What does that say about our healthcare system? Oh no, COVID's gonna get us. We've got 3 people who've got COVID. Run, right? It's just awful. It's just awful because there's no arguing with them. There's no arguing with them, right? Like, they write these articles and it's like, oh, well, yeah, that's the number one cause. How many cases did it result in? 10, 12, 15? Is it the Mennonites? You lock those people down, right? Like, a couple of days ago, they were talking about how that's the biggest spreader of the virus these days. You know, a couple of weeks ago, we had 5 and now we've got 20 and blah, 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 blah. So seriously, I think it was probably the Mennonites. But that doesn't give them the right to lock them down, right? How many of them were in hospital? 1? Randy Heller says, TO General, TO Western Hospital, and Princess Margaret Hospital, TO Rehab and Michener Institute. There are 15 COVID patients and fewer than 10 of them are in ICU. Is this a crisis? Brian Lilly, Ontario doing well on COVID despite what some experts say. So this is, I mean, again, we're in a situation where what they're telling us, what the newspapers are telling us, what some newspapers are telling us is fear, fear, fear. Everybody, oh no, COVID, 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 it's going to get you. In Guelph, it's going to get you. It's going to get you if you go visit your friends and family who aren't sick. How? How do healthy people spread illness? How do even sick people spread COVID if they've not been exposed to COVID, right? Like there's no exposure. I don't understand. If there's no exposure to the illness, it's probably just a cold, which is a coronavirus, but not COVID-19. And why are they selling us this? Your healthcare system is at the top capacity when Guelph's not at the top capacity, and all of these Toronto hospitals, which is in the epicenter of this whole thing, are not at capacity. They're lying. They're lying. They're lying. We will be judged by what we do here. Here's sad Santa, says Joe Warmington. This is Santa behind plexiglass. Don't take your kids to do this. Don't take your kids to do this. This is not. No. Don't do this. Don't do this. Have somebody dress up and come to your house or something like that. But this is just not what this is about. And this is done under the guise of safety, but this is stealing our culture from us. Is it okay to, is it okay to remove all of who you are, what makes you who you are, what makes you able to sustain yourself for your safety? How is that for your safety? How is a safe injection site doubling the deaths safe? They doubled the deaths. And they're not looking at mothballing this project. I wonder if they'll triple the deaths next year. Go for it, Cam Guthrie. Great leadership. The people who rule you know that if you won't fight for the right to breathe properly, the sky's the limit for your perpetual enslavement. At what point? How bad was it 3 months ago? How bad is it now? At what point do we stop and say no? I don't know. I don't know. People seem just fine with this. Arrested at Costco, just fine with it. That guy probably should have listened, right? No, he had a right. He had a medical exemption. It's recognized by law, by Ontario Human Rights Code. And I don't know if he was in Ontario. So maybe he wasn't covered by the Ontario Human Rights Code. However, there are other human rights codes in other provinces, and I believe that most of them say that if you have a medical exemption and a disability and an inability to wear a mask, one, you don't need to justify that to anybody, and two, you are allowed to use a service like a store and access it. And maybe I'm wrong. Maybe I'm wrong. Maybe I'm wrong about having Dominion choosing the candidate is flawed, is a terribly flawed upside down system, because that's not really choosing, that's not really having a proper vote, right? Like it's not. It's the opposite of having a proper vote. Like here are these two puppets we've decided that you get to vote for, and Dominion will choose them, and you get to choose from that, right? Democracy. Aren't you happy? Welcome to post-national Canada, right? Where the case numbers are all that matters, and the actual reality of this is they're stealing your freedoms from right under your nose. It's just terrifying. It's just terrifying. Okay, I wanted to point this out. I read through this. This is a long thread. I'm just going to show you some highlights here. It says Pfizer is telling you that they have a new mRNA vaccine that they have tested on 43,000 people with a 90% efficacy. I was going to say efficiency, and then I knew it was efficacy, and that's what stopped me from being able to speak. It's not true. It's not true. The Guardian pretended to play it down whilst whetting your appetite. Standard Mockingbird media tactics. Okay, so I'm going to scroll down. So what's the study? It's supposed to be a concurrent phase 1, 2, 3 study. We don't do those. Why? Because you need the phase 1 study to see if your new drug is not going to kill people. Remember what happened in the UK? This was a phase 1 study gone wrong. Catastrophic clinical trial that left 6 volunteers fighting for life in intensive care became notorious as the Elephant Man drug trial because of the horrific side effects they endured. Okay, so sometimes keeping you alive is not so good, right? There was huge publicity for this, and this prompted big changes in the way phase 1 studies are conducted, not just in the UK. Phase 1 studies are highly controlled, particularly for new classes of drugs like mRNA vaccines. But we have Operation Warp Speed, so that doesn't matter. The protocol is here if you want to read it, and I'm just going through this quickly because I'm going to get to the important part very shortly. That's not it, though. Here it is. Hold on. Okay, here's one important thing. Importantly, confirmation the drug is stored at minus 80 degrees Celsius. It has to be if it's mRNA, because mRNA downgrades outside of a biological host at any higher temperature. Anybody that's worked in a lab with this stuff can confirm how unstable it is. So why is that so important? I'll come back to it later, but storing at minus 80 degrees Celsius is no mean feat. It usually requires liquid nitrogen and heavy-duty freezers. You can't do it in a standard clinic. Dry ice will get you down to minus 78, and then it evaporates. Something else a bit fishy about the phase 1 study report, the accession number. The group says that they have deposited this number with GenBank. This should be an RNA fragment. And this is what GenBank says, so there's some questions there. Anyway, back to the main study. The phase 2-3 study, Pfizer reports that 43,000 patients have received the vaccine. Let's unpick that back to the protocol. Here's the schedule for a single patient, 3 pages. Most people don't realize how intensive these studies are. They require multiple attendances, and for each attendance, a form needs to be filled in, and all the protocols checked. Each person involved has to know the 146-page protocols inside and out. For a study like this, a small unit with a doctor, research nurse, and administrator could handle maybe 20 patients. A large center, maybe 100 patients. Beyond that, this paperwork is unmanageable. Pfizer said 43,000 people have been recruited, so there should be 400 to 4,000 recruiting centers around, all with minus 80 storage facilities in the same place that there are nurses, doctors, and established clinical researchers. If you belong to one of those, please join the conversation. I have questions. And just as a quick aside, okay, some of these apparently advanced medical centers are in World Bank Tier 2 category. I have medical and scientific colleagues from these countries who tell me what their health systems are like. So in addition to needing those freezers, and I'm going to get to this in just a minute, but I'm making a point, promise, you have to believe that these freezers are available in places where medical systems look like this, okay? Right. I guess it's possible, says the Twitter guy, whose Twitter handle is Arcanicide is real, so take that with a grain of salt. I guess it's possible they have many health centers with all these facilities and minus 80 freezers in these places, just like it's possible to catch a live cicada. Anything is possible. On the subject of statistics, let's look at why COVID-19 vaccine study is problematic. So the freezers, let's talk about the freezers. Here's Danby, and Danby's in Guelph, interestingly enough. And they're stepping up to produce freezers for to store future COVID-19 vaccines. So where are they getting these freezers now? Danby's stepping up to produce freezers to store future COVID-19 vaccines. How are they testing these things? How are they transporting these things? 2 recently announced COVID-19 vaccine candidates require being frozen at very low temperatures, which is where Guelph-based manufacturer Danby Products, makers of 500,000 freezers a year, believe it can help. Danby is on the cusp of announcing a new super cold medical freezer to store RNA vaccines, said President and CEO Jim Steele by phone on Tuesday. Once removed from the deep freeze, each vaccine will have to be used within a matter of days, which Steele said will create a logistical problem. The big question is, where are these freezers going to be located? And do you put a bunch in Toronto and then drive the vaccine out to London for the day? Or do you put one in every hospital or every pharmacy? Yeah, getting the CEO of Danby to muse, maybe we should put one in every hospital. Yeah, how many hospitals are there in Ontario? Click, 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 click. Plus, how many pharmacies? Yeah, I think we probably need them in every one. Thanks for asking, Guelph today. I mean, that's some PR for Danby, right? But who's making the freezers now, right? How are we testing these 43,000 cases? How are we making sure this vaccine isn't going to hurt people like previous vaccines have done? There's the H1N1 that I showed you out of New Brunswick, and there's the 2009 H1N1 narcolepsy out of UK. Sorry, that's what I was referring to when I said H1N1 earlier. That the UK government has had to pay out a lot of money for. There's a lot of problems with quick rolled out vaccines. So we're in a world now where it's illegal to access your rights at Costco. It's illegal to consider having people over to your home or doing anything normal because of 119 cases. And of 119 cases, one of those is in the hospital. But, you've got to listen to science, right? I'm not believing it. Call me skeptical. Moving into some other political stuff. Stephen Gellibo is talking about the Global Conference for Media Freedom. Not only is press freedom a cornerstone of democracy, it's a fundamental building block of strong, healthy societies. When journalists can do their job, everyone does better. Ooh, good time to talk about this. Canada Poly is down because of my stupidity and not because of anything else. I was upgrading the forum, and the forum upgraded just fine. And there's a link program. There's a program that links the podcast version and the form version of the post, and also the original post on the blog. So it creates the blog page, it creates the forum post, it puts up the audio to my podcast aggregator. So what I did when I installed the update, the update for that bridge program, the forum's okay as far as I can tell. The forum's okay. It's just not loading because of this program that is linking it to the WordPress installation, and that's creating a 503 error on the server every time I try and fix it. So I thought I had it fixed yesterday, and it didn't work out. So I'm hopeful that I'll have it fixed this afternoon. So I apologize for that. Nobody took me down but me. So it's just me being dumb. So I apologize. I'll get it back up soon. It's going to happen very, very, like today or tomorrow. Hopefully today, but yeah, if things go bad again, maybe tomorrow. But it will be back up shortly. And but I think that this is funny. Not personally aside, back to the politics of this. Justin Trudeau and his MPs and his Liberal government took the Rebel News and True North and Andrew Lawton to court to prevent them from covering a public event. Like, just wild. Like, they just lie. They just lie. Here are the Liberals talking about how if these documents are voted to be given over, then we will immediately start legal proceedings to stop that from happening. These Liberals do not want these documents to come out. I think they're willing to go right to an election for it. But maybe this Dominion thing has got them a little spooked, and they're worried about something else, so they're trying a different tactic here. So they're just going to try a legal tactic. This I thought was very interesting. China is a global neighbor towards a rethinking of Canada-China relations. Ha. It's on November 24th at 7:30 p.m. I mean, I just think that it's a very interesting time to highlight China as a global neighbor, considering all the context that's happening currently. It's a very interesting choice. And was I saying BGY or BYG? And I can't remember if it's supposed to be BGY or BYG. I think it's BYG. I'm going to stick with BYG. But in light of BYG and all of the Chinese targeting of politicians, like if I was a politician that had my name attached to this, I'd be like, a little leery of that, especially if there's anything else going on, right? I mean, maybe not. Joe Biden doesn't seem worried about anything, does he? Very interesting. Here's the RCMP. If the minister and senior RCMP leaders fail to act on my findings, the organization will continue to fail at upholding the right of access. I thought this is funny. The Information Commissioner slams RCMP for access to information failures, calls for urgent action. Parliament's Information Commissioner said Canada's federal police force needs an urgent change of course when it comes to handling requests made to it under the Federal Access to Information Act. In response, the minister in charge of the RCMP, Public Safety Minister Bill Blair, issued a ministerial directive that the RCMP must respond to the Information Commissioner's scathing indictment in full within 3 months. I mean, if you're in trouble, it's like you do it by the end of the week, man. But if you're not in trouble, you're like, yeah, can you get to it at the end of February, right? End of January, early February, whenever you've got time. Next 3 months or so. Oh, it's Christmas. Next 3 months or so. I think they're taking it very seriously. Sure. Here's the House of Commons staffer. He says, let's also remember that accused stalker Marwan Tabara is 1 year away from a lifetime pension and is making $182,000 while facing 2 counts of assault, 1 count of break and enter, and 1 count of criminal harassment. He's back in court on Friday. If he goes to jail, does he have to remove it? Like, does he have to give up his seat? I actually don't know. Does anybody know? If you know, let me know in the comments. I'll pin it. If he goes to jail, does he have to give up his seat, or can he just can he check in from the House of Commons from like an iPad that they give him? Oh, it's question period, Mr. Tabara. Here you go. Here's the iPad to run the country. Thanks. Is there a rule that says that a prisoner's not allowed to sit in the House of Commons virtually? Oh, there's no rule that says that, says the Liberals. We just want to keep that slam dunk vote. This is just, like I've said before, in Guelph, the news media, what they say, the doctors, the health officials, Dr. Mercer, are telling you one thing, like COVID's spreading rampantly in houses and visiting your family and your friends. And like I can see with my eyes, 119 active cases. Where are they spreading? Where are they spreading specifically? Like, how many of those are friends and family cases, right? How many of those are spreading friends and family. Really. I have a hard time. Call me skeptical. And now they're suggesting early closure of schools. And what they're trying to do, and this is not, I don't want to have this happen at all, but what they're going to do is they're going to mandate that the kids log into the laptop. And again, I've heard there's been people message me, and it's wonderful. I appreciate hearing from people. So if you've got a lead or a tip or a picture of something, or something's happened to you that you think I'd find interesting, I'm always interested to hear stories. But how I work is like, I mentioned it like this, right? So anyway, he sent me a message talking about how they were recording his kid without his permission or knowledge, and the only reason they knew was because the Microsoft Zoom meeting that they were using said, recordings now, and 35 minutes. Oh my goodness. Anyway, so, and he got his kid exempt from being recorded, but what they're trying to do is tie you to logging in every day and checking in, and I mean, remember Big Brother? Did you read 1984 with the screen on the wall could see you? We're there, man. We're there. How many cameras are looking at you right now? I've got mine covered. If they're not on, if I'm not actively engaged with them, I've got them covered. But really, we're at the point, right? And they're starting to ask for snitches, right? Brian Pallister is saying if you see something, say something. They want snitches to tell on people, right? So we're well past the point where, at what point are they going to use the front-facing camera? Wear your mask, or you're not allowed to use your phone. Sorry, the Wi-Fi is only for masked people, and your phone can tell that you're not masked. So, sorry about your luck, right? Oh man, get some paper books. Run far and run fast. Here it is, voting. Last story for today. Nevada AG admits that they changed signature verification manually for over 200,000 votes. This whole thing's just a farce, isn't it? It's a farce. It's just like our Canadian elections, where we get to choose one of two pre-selected leaders, right? Chew on that, you animals chewing cud, right? You sheep or cows or whatever you want to equate us with. It's just very, and people don't want to hear about it. They don't want to hear about it. They don't want to hear that their way of life is in danger. They don't want to hear that it's gone. They don't want to hear that it's just gone. Forget about it. Remember when you used to go and visit Santa and go out and buy extra chocolates and feel a little guilty about that? Not this year. Forget it. Not anymore. Right? And why? What for? Safety? Promised safety? We promise you'll never get sick again. Wear this mask and you'll be fine. Promise, says the government. Bullshit. Absolute bullshit. Liars and bullshit. So what do you do? Until more people wake up? Nothing. Until more people wake up, look for a way out. Nothing to do, because there's nothing going to happen. And you're not going to be allowed to do anything. And the problem is, it's not that you're going to change. It's that what you're doing is going to be made illegal. That's the problem, right? And they'll just, it's okay to shoot 12-year-olds on the street in Toronto. But if you dare walk into a Costco without a mask, the cops are coming for you. And that's where we're at. Snitch on your neighbors, and the cops are coming. Costco, watch out. It's unbelievable. And it's scary. And I said, I think at the beginning of this, I hope by Christmas COVID was just a distant memory. And, well, I was wrong. Thanks for watching, everybody. Check out CanadaPoly.com, and I'll get the forums back up soon. Check out CanadaReport.co. Check out SpeakingMoistly.co. Greg and I talked about all this stuff yesterday as well, too. Oh, I hate that. So yeah, we discussed it, and it's not getting better. It's not getting better day by day. So at what point will it be enough? At what point will people stand up and say, we're done? I don't know. I hope it's soon. Thanks for watching, everybody. Have a wonderful, wonderful day.